The one certainty in life is death. It's never easy for anyone involved, but over the years, certain expectations have arisen on how you deal with it. Introduce a fatal global pandemic, and all those expectations are swept away by events. In this film, we discover how COVID-19 affected Essex. You'll hear from people whose only connection is the devastation of COVID. Later, we meet a GP, the medical director and palliative care sister of a hospice, a community nurse, a hospital chaplain, and an undertaker. Each had their unique traumatic part to play in helping others cope with the shock and horror that COVID visited on communities. You'll see COVID-19 through their eyes. You'll hear what they think should happen if and when we're faced with another such national emergency. We begin with Norma. She and her husband Frank were enjoying an active, fun-filled retirement in Frinton. Frank had been a London cabbie. Norma had worked for Ford's in quality control. They had a massive circle of friends and a loving, supportive family. And then COVID hit.
I got ill on the Monday and I took to my bed. And then on the Wednesday morning, my husband was getting washed in the bathroom and he collapsed. He was getting ready to go to bed on the Wednesday evening and he collapsed again, but this time it was bad. I had to struggle out of bed to call an ambulance, and when the paramedics arrived, I just left them to it and crawled back into bed. They ended up taking us both to hospital in the same ambulance, and the consultant came to me and said, "Your husband's not going to make it. He's too ill to go on a ventilator. He'll never come off of it." He said to me, "He's got pneumonia and his cancer's back." So from that minute on, I kept saying, "I need to see him. I want to see him." And apparently the matron in the ward where he was, we were at opposite ends of the hospital, I learnt later. She said that I couldn't go to see him. So this young nurse, Emma, she fought hell for leather to get me there. And on the Saturday morning, she came in and she said, "I'm really going to try to get you there today." And later on that day, she brought some scrubs in for me and said, "Get changed, put these on, I'm taking you to see your husband." So they took me there in a wheelchair and there was like a rolling blockade. There was security guards, nurses, doctors, office workers, security all along the corridor and telling people to get in, get back. And finally got to the ward where my husband was and they took me in and he was kind of laying on his side and he was holding a yoghurt in his right hand and he'd taken the oxygen mask off his face. And I think I knew he'd gone, but I was hoping it not to be so. So I was talking to him, telling him, "Look what they've made me wear to come and see you," and stupid stuff like that. And I was holding his hand and I said to the nurse, "Why is he so cold?" And that's when they said he'd gone, but I knew he'd gone. But I was willing him to be just asleep. I even put the oxygen mask back on his face. But I wasn't there when he died, and I don't think anybody else was. Had they known he'd died, that's why they let me go there. Why didn't they let me go there before? It's just so cruel. I just don't know. Anyway, when I was at home and I I was making all the funeral arrangements, all done over the phone because we couldn't go out, and I couldn't go out anyway. I was isolating, and I was still ill, and I had to arrange everything over the phone for the funeral. And my eldest daughter helped me as well by sending emails to the funeral directors. I even had to pick out the coffin over the phone. And when I actually saw it, I thought, no, I wouldn't have picked that if I'd seen it. From that word COVID, the funeral directors wouldn't touch him. They said he had to go in a sealed coffin and be taken away to cold storage for a month before the funeral. It'd be sealed in the coffin. I'd got his suit ready for him to be dressed in. They wouldn't touch him. To this day, I do not know what he was wearing in when he was put in the coffin. Whether it be a hospital gown, I don't know. They wouldn't embalm him, they wouldn't touch him. I was told that only 8 people could go. They wouldn't allow any cars. I had to drive myself to Wheeley, the crematorium, and I had to drive myself straight back home again. Only 8 people allowed. And my 2 daughters and son-in-laws knew that I would be sitting alone, so they sat alone to make me. They sat separate. They could have sat together. They lived together, so they could have sat together, but they didn't because they knew I was sitting alone. They sat alone as well. It was cruel, very cruel. It's the not knowing what he was wearing, and the fact that I didn't get to say goodbye. Well, I wish they'd have let me go to see him before he died. I needed to speak with him and to be with him, and I also wish that he hadn't have died when he did, because he picked the wrong time, because it wasn't normal. Nothing was normal. I sometimes feel cheated for him because he didn't get the funeral he deserved. He knew so many people, and only 8 people allowed at the funeral. They didn't even carry the coffin, it was put on a trolley. The whole thing was demeaning.
Norma from Frinton. Father Hugh was hospital chaplain at Broomfield Hospital in Chelmsford. It was usually a hive of activity, but all that changed when COVID hit.
The normal hustle and bustle of Broomfield Hospital had gone. And when you got to the wards that were being used, yes, they were very, very busy. The normal working life of the hospital had stopped in that sense, whilst it was focusing on these particular wards. Being there for people who are dying is a great privilege. And this, though, became intensified really because at times I was allowed to be there when family and friends couldn't be there. I think the vast majority of instances I saw were of kindness, that people knew this was a difficult moment, and there was a sense that we were all facing something unknown and really quite traumatic in a sense. But the majority of people I encountered really responded with kindness. There were sometimes I remember having to, step in between family members and nursing staff and ward staff and people in the hospital who were trying to do their best, but everybody gets tired, everybody gets worn down, and not everybody, can respond well in these situations. So there were times when you did have to try and calm situations, but in the main, most people I responded incredibly kindly and really rather bravely, really, in all that was going on. Particularly, in those early bits where we were so unsure and uncertain, and nobody really knew what was happening. Um, I think people responded really well. The ongoing effect on staff, mainly that I encountered, would be exhaustion. I mean, they were just, the exhaustion came at different levels. They were working very hard. Um, so they were working really hard. They were exhausted. But that exhaustion wasn't just physical; it was an emotional and mental exhaustion. That the intensity of what was happening. So that, I think, was something so many of them felt. And again, the situation of not really knowing how this was going, how it was going to work out, how it would come to its conclusion. The sense, so that first sort of March, April, May time, um, people kept going in the expectation that there would be an end soon, but then having to keep going again and then keep going again, and I think that was a major um, issue, and I think probably still is. I mean, it's how people have been so affected by that intensity of having to keep going. I think there has to be a much better plan of care for the hospital staff themselves and their own emotional and spiritual needs that came out of it. They were giving and giving and giving, but you can't do that. That's impossible. There comes a point you can't do any more. And I'd say in planning for the future, it would be, planning for that care.
Hospital chaplain Father Hugh. Hospices across the country were put on alert at the start of COVID. Nicola is the deputy sister on the inpatient unit at St Helena Hospice in Colchester.
I was here the first day that we actually took I was on shift the day we had our first COVID positive patient come in, and I remember fear, really, with it, that realisation, that this is here now and we're going to be dealing with this, and we didn't really know what we were doing, because obviously it was all so new and everyone was finding their feet, and just an air of fear, with not just with the nurses, with the cleaners, with the catering staff. Everyone was worried, and obviously then we got into the swing of things with looking after the patients, and as you can imagine, there were lots of changes and updates because everyone was learning as they were going along with regards to policies and procedures that we were keeping on top of. The way we were then nursing was so anti the hospice way of nursing, I suppose, at the time, because restrictions in contact, having physical barriers, i.e. your masks, your gloves, that kind of thing, the restrictions of people coming in, patients being on their own. And I certainly saw firsthand the effect of patients being shut in a room with the door shut. That's very different. We usually have the doors open. People are popping in and out. It wasn't a question of just popping in and out. We were going in when we were needed, and when we were called, rather than just a smiley face. You couldn't see those smiley faces because they were covered with masks. Yes, we were wearing PPE, sort of all the time, with the mask when we were on the unit. When we were in contact with the patients, you were gloves, apron, mask, visor. So it was, it was a lot to what we were used to, really. Obviously, the rules and fluctuated through different points in COVID. So there were times when patients' families could come in, sort of restricted, or one or two people could come in. And when you're dealing with a bereaved person, I mean, a touch of a hand, an arm around the shoulder, when people are distressed, when you're, instead of social distancing, I mean, that was something that really struck home with a lot of the members of the team, which was so alien to not be able to show that physicality, I suppose, and support that seemed, obviously is natural in that context usually. Personally, I felt there was a bizarre thing when you're everyone's at home, you know, stay at home and keep away from people. You're hearing that on the news and everywhere, and then you are going into your work environment where you are knowingly walking into a room with someone who has COVID. You know, it was a strange situation to be in, and it was very worrying. Working under that kind of pressure every day was tough, definitely. And I remember being so relieved when I got the phone call to say, yes, you can go and there is a vaccine, you know, you are now allowed to have a vaccine. There was one available. That phone call, I actually got it on my birthday. It's like the best birthday present ever, you know, and went the next day and had it done. And it was such a relief. And I know my colleagues, you know, really, really found that.
Deputy Sister Nicola on looking after COVID sufferers and their families in the hospice setting itself. Nikki looks after hospice patients in their own homes.
I think we were one of the few services still visiting, so there wasn't a lot of face-to-face contact with other services. So families were very grateful that we were still visiting during COVID, even though we were restricted slightly with the PPE and the distance. They still felt comforted by someone visiting. Part of being a hospice nurse is that extra touch, that going the extra little mile, and I felt that was taken away for patients and families during COVID. We had to wear full PPE, so gloves, aprons and masks, and we weren't allowed to take those off until we'd left, just gone outside the property. So already it felt like a barrier when you knocked at the door before you'd even spoken to the patient or the family. Prior to COVID, and now that things have changed, you know, if a patient wants you to sit next to them on the sofa to talk to them, that's what you do. But we couldn't, so we had to sit the other side of the room to ensure that safe distance between. And then we lost that therapeutic touch, the holding of a hand. That was all gone. So it felt very impersonal. I was scared about me taking it into the patients unknowingly. I mean, we tested weekly, but you know, I could have been to someone that had it that didn't know they had COVID, and I could have taken it into a vulnerable patient, and scared that I would take it home to my family. I've got a really supportive family. I love listening to music, so between visits my music would be very loud in my car, because I found that a good way to unwind and try not to overthink everything, because it was quite easy at that time with the news and everything to overthink COVID, and you could drive yourself a little bit crazy, I think. I think patients were very scared. They were scared of what was happening to them anyway, and then COVID on top. Patients weren't able to see family members, and some patients were too scared to see family members because of COVID. And you know, we see patients in nursing homes and residential homes as well, and they were seeing their relatives through a window. Grandparents weren't able to see their grandchildren and have that time that is so precious before you die. That was taken away from them.
Hospice community nurse Nikki highlighting the problems of PPE and social distancing when looking after terminally ill people. Dr. Emma was medical director of the hospice.
In the lead up to COVID, I think we were starting to get quite anxious, seeing a lot of the stuff coming from Italy and a lot of the images of kind of the chaos, and there are lots of pictures of people dying in and makeshift morgues and that sort of thing. So that was all starting to appear on our, we were sort of aware of that and obviously starting to worry about what impact that was going to have on our practice. But also a bit in the dark about what that was going to look like in reality, and I don't think we were really prepared for suddenly then everything changing. And then overnight it just became very quiet, I think was the most kind of noticeable thing, because anyone who didn't need to be there couldn't be there anymore. One of the things that has struck me since is a lot of the focus around visiting and around dying is about being with somebody as they die, so kind of the moment at which they die. But we know that dying is a process, and I think one of the things which was very difficult is trying, if your loved one is unwell and you can see that they're unwell, that picture kind of is so much more powerful than any way that I can describe that to you. So trying to describe over the phone how somebody was deteriorating, and I think we, not for want of effort on our part, but I don't think we could ever quite get that picture across in the same way. And what you realise is that that's what a lot of families then missed, is being able to see that deterioration and understanding that. So, if the last time you saw your loved one, they were relatively well, and now they've died, that's very different to seeing that change from being relatively well to being less well, to being very unwell, sort of thing, and seeing that transition. What has happened since is people wanting to have a conversation about what happened, having a lot of unanswered questions. And I think that's what we saw more of at the time and have continued to see more of. Having that information won't change the situation, but it allows you to process it and make sense of it. And I think that's what we saw, is lots of people struggling to make sense of what had happened because they hadn't seen it with their own eyes.
Dr. Emma, with her thoughts on the possible long-term effects of COVID on the families of the deceased. Paul is an undertaker. When did he first receive guidance for his profession?
Guidance came out fairly swiftly when we were watching the news from the countries around the world before it sort of really hit the UK in the fashion that it did. And so we were kind of getting ourselves prepared just in case, and it wasn't straight away even when we went into lockdown that the correct guidance was being given, or what we deemed to be the correct guidance. There was a lot of grey areas and different conflicting stories, and you'll do this, then you won't do that. So it did change by the hour in the early stages. There was no real, you must do this or you must do that. It was, we think you should do this. So it's quite varied, the stories that we were getting and the instructions we were given, whereas one local authority will say one thing and another local authority will say another thing. And so yes, it did vary across what is relatively a fairly small patch of Essex. They started off being very, very low, capacity allowed. One particular crematorium, they said you can have 12. This was on the Friday. The funeral was on the Monday. Friday evening they said, oh, you better tell your family you can actually now only have 5 mourners. That lasted for a couple of weeks, and then they went back to 12 or 20, I can't remember what it was, but they changed the numbers again, but no, the circumstances remained the same. There was one crematorium that said you can't have any mourners, just don't bring families with you. At the time when we went into lockdown, we were actually doing most of our funeral arrangements over the telephone. So the family would sit in front of our website, we would sit the other side of it and sort of talk them through the normal face-to-face experience they generally get, to give them the guidance of what they could have, what they couldn't have. But yes, we were the ones that were saying, well, at the moment you can have up to X amount of mourners. The problem then, of course, because the death rate was getting quite high, The crematoriums were getting rather booked up. Some of them did increase their time capacities, extra slots. Locally, none of them did. Generally, we use our private ambulances that we carry the deceased in, so we would collect from hospitals as soon as they were released into our care. Most hospitals would put the deceased in body bags to the point where they themselves run out of body bags. So we were then collecting them in our own stocks, which depleted really, really quickly. We, at the beginning of COVID, actually put a great big order in for body bags, all the PPE, the gloves, etc., the masks, paid a huge deposit to get the delivery. Delivery never turned up. We queried it numerous times, and basically they said it's all been requisitioned by the NHS. I said, well, nice of you to tell us that, because we have people basically on the front line that need the stuff as well. One of the local authorities, not in this immediate area, but one of the local authorities said that we can supply PPE, we can limit it per company if you want to drive. It was a 40-mile round trip, or one direction trip, sorry. So an 80-mile round trip to be given your allocation of PPE. Twice we went. The first time we went, we came back with 5 pairs of gloves, 5 aprons and 5 face masks. Next time we went, they offered us less, and so we just turned around and came away. We just had to make do with what we had, and some PPE we just couldn't actually physically use. We had an experience where we went into one of the private hospitals. It was actually on Christmas Day, and it was deemed to be the COVID ward, and even the staff there were not wearing full PPE because they hadn't got it themselves. So that was a real eye-opener to actually think the hospital staff looking after these patients prior to death couldn't actually get the equipment either. So it was a very big eye-opener, and clearly a lot of lessons can be learnt from this, I'm sure. What should be done differently is that more PPE should be made available, and at a sensible price. That was one of the things that we were suffering with as well, where we'd be buying, say, a body bag at £5 each. We were being sold them at £50 each. So that would be one thing where people were told not to monopolise or cash in on the crisis. I can assure you, and I've got invoices to prove that people were. And so that would be one big change, to have some policing or distribution in such a way that the adequate supplies would go to all the care professions. It was, at the beginning with, we weren't even deemed to be frontline workers. Well, if you're taking people out of a bed in their house, there's nothing more frontline than that. Obviously, facing bereavement anyway is never easy. A lot of their problems were that they couldn't say goodbye to their loved ones if they're in hospital, and then again, some of them couldn't attend the funeral services, either through restrictions or the fact that they had COVID themselves and couldn't attend. And so there were a lot of problemed people out there that I think this is going to have a long-term effect on their bereavement pattern, if you like, whereas they've had no real closure to the death, and I think that there's going to be problems in years to come. What could be done differently? I think we were in a fortunate position where some of the services, depending on the location, were actually live streamed. So I think that could be a broader way of tackling things when people weren't in attendance, just so that they can have some involvement, although it's not the same, at least it's something. But obviously not every crematorium or cemetery could offer that at the time, but thankfully it's come on stream a little bit more nowadays. So that would be one of the things that was done differently. And I think the awareness now of what happened will make people think, or hopefully accept that if it were to kick off again or something like it, then they know that they can't have all the choices that we would normally have in everyday normal society, a normal lifetime.
Funeral director Paul. Dr. Caroline is a GP partner in the Danbury surgery, one of the first in the country to receive the COVID vaccines. What was the initial response to the pandemic in her community?
I think the initial response was fear. I think everybody was very scared of the unknown. We went through a phase, I remember it vividly actually, in that first week where people were in lockdown. We were expecting to do a lot of palliative care. We thought we were going to be just doing that. In reality, what turned out in that week was people stopped calling us, and that really worried us because we were still there and our whole team was there. And I think people were so scared of the whole thing, and they didn't want to overwhelm the NHS, because there was that message, if you remember as well. They weren't calling us, and that was eerie. So we had to move rapidly to a state of using technology in a way that we'd never done before. And of course, the poor patients had to get used to that as well. It's not easy, a video conference, it's better to do it than not, but actually it's not the same as seeing somebody in person. In that early stage, when we weren't getting the calls, we decided we'd turn it around a bit, so we did welfare calls. So we used our receptionists and our GPs and our nurses and our clinicians to call people. So we did 3,000 calls in a couple of weeks. And we started working with the parish council too, so we set up a little system where there was a kind of red-green card system. So if people were in trouble, people could flag it to us. And we picked up quite a lot of people with that. Paper boys were reporting things. There's a red card in the window, what's going on? And we were picking up people who were deaf, where they were running out of food, they were suicidal. Really heartbreaking situations, where people were cut off and they didn't have a means to reach out. Or just lost the will to live, I think. Some people genuinely just thought, well, this is my time, and that was really heartbreaking. It would have helped, I think, if there'd been stronger communication from the centre earlier. I'll give you a small example, actually. It's quite a big example, I guess, really, because I was very privileged. We were really privileged to be asked by the commissioners at that time to be the first vaccination clinic, which was really positive, and that really lifted everybody's spirits. We were really excited about it. And the local people were great. We had loads of support, and they were really, really helpful in getting it set up. We did not get the national directives, the PGDs, the way we prescribe vaccines for HCAs, nurses, to issue these things, right up to the deadline of opening. And even beyond, there is a simple procedure. You have to sign off a patient group directive to allow HCAs to vaccinate, because they're not regulated. They're trained, you have to do all the training. And with a PGD in place, you don't have to sign lots of paperwork. And I remember sitting, because Matt Hancock had to sign this off. He had to sign this off nationally, that we could do this, because it was a new thing, the vaccine. It was a new product, and this is why it was really complicated. And I was told this, it was sitting on his desk to be signed. So because he hadn't signed it, and Patricia McAllister and myself sitting in the first vaccine clinic, and we had, for every single patient, and we were vaccinating hundreds and hundreds and hundreds and hundreds, we had to sign off individually all of the prescriptions. So you had two really experienced doctors literally having to sign, and that mirrored that across the whole country for all the vaccine clinics, but because somebody up there hadn't got around to signing it off. It was slightly insane. It has to be said. And it's that sort of thing, that disconnect really between the reality of having to deliver a good, safe vaccine clinic with the distance of NHS England and also, the centre. That they didn't understand the implications of delays in decision making for us trying to actually get vaccines in arms. The PPE we received from the NHS was both inadequate and also out of date. Essentially, we received stuff that the expiry dates had expiry dates put on top of them. So you could take one off and you'd see the expiry date below it. So it was not just out of date, it was out of date, you see what I mean? So it was a bit shocking. And you've got to put it in the context of a global shortage of PPE, I know, but A, we received it late, and B, it wasn't keeping staff safe. I think I'm not an expert on this stuff, but something went badly wrong around supply of PPE, badly wrong. And I'm sure there are people in hospitals and probably in primary care too, and I know GPs did die during COVID times who may have done so because they were inadequately protected.
Dr. Caroline, a GP on the front line of the fight against COVID-19. Our film is intended as a community resource. Please use all or any part of it if it helps you prepare for any future national emergency. What can we learn? Are there things we could do better? If so, what? Our sincere thanks to our contributors for speaking about their experiences. They are the beating heart of this film. The final word should come from Norma from Frinton, whose life was changed forever.
It was something like I've never seen before, and I think everybody was terrified. No one really knew what was going on. It was just a terrifying experience, and it was like something out of a movie.